Good evening, everybody. Thank you for coming out. I think this is one of the better attended PharmaWise series we've had since we started them last year. But spring has sprung and the sun is shining, so we're all happy to be out and able to do things. My name is Aaron Nixon. For those of you who don't know me, I am the owner and pharmacist at Mainstreet Pharmacy and Wellness Center here in Kingsville. This session is done in conjunction with the Kingsville Community Center, as well as the space being generously donated by the town of Kingsville. So we want to thank them for helping us out with that and helping get information out to the community about safe use of medications and medical conditions. This evening, we will be talking about safe use of over-the-counter medications. It's a common misperception that just because it's over-the-counter means it's safe, or just because it's natural means it's safe. Well, arsenic and cyanide are natural too. So everything needs to be checked and made sure that we're using it appropriately. One of my favorite quotes is from Paracelsus. The poison is in the dose, and sometimes it's a little, sometimes it's a lot. But when you look at over-the-counter medications, there are a lot of overlap where you can accidentally get into some trouble where you're taking the same ingredient in multiple forms without even knowing it. So today we're going to be covering some common pitfalls of over-the-counter medications, what you can do to safely use them, and then we'll have a little interactive component at the end of the slides, or at the end of the presentation. During the course of the presentation, you're going to hear me refer to certain products either by their brand name or their chemical name. I'm just putting a disclaimer out there. None of this is sponsored by any pharmaceutical company. When I'm using the brand name, it's just for ease of reference for people who may not know what the chemical of the product is. So let's start with what are over-the-counter medications? Well, as the name implies, they're medications you can get over the counter. But that doesn't necessarily mean that they need to be got in a pharmacy. In Canada, certain over-the-counter medications or certain doses of over-the-counter medications that are considered unrestricted or unscheduled can be sold in gas stations, convenience stores. I'm sure you've all gone in and seen the little tubes of Advil when you're buying your gas, a little tube of Tylenol when you're picking up your lotto ticket at the convenience store. But it also includes herbal supplements, as well as things that are kept behind the pharmacy counter that, while they're available without prescription, they still require a pharmacist's intervention. And there are things like that that have common ingredients with other over-the-counter medications. The major definition we're going to be looking at today is things that don't need a prescription, things that you can get without going to your doctor and without going through a registered health professional, such as a pharmacist, nurse practitioner, dentist. We will be talking about some herbal supplements today because there are some risks associated with them. They're not typically lumped into the over-the-counter medication group, we'll call it, but they do have their own pitfalls that we'll be covering some of today as well. So, what can you use over-the-counter medications for? Well, cough and cold, pain, allergies, eye and ear conditions, oral health, supplementing with vitamins and minerals, and generally trying to keep your health up and running. We use them for a wide variety of things and a wide variety of conditions, but that does not always mean that they are safe for everything. We're going to do a little quick interactive activity here. We'll get to the real interaction later. But what do these different products all have in common? Anyone have any idea? Each grouping of products has something that they've all got the same in. Well, they're all over the counter. That's good. That is correct. And then, so we'll go over some of the common things that are in each of these, and then we're going to do a little matching game at the end of the presentation. If we can jump to the next slide. These all are all available over the counter, and they all have something in common that when you look at the products, you don't see. They don't seem like there's actually anything in common there. And here as well. So we're going to cover all of the different ways that over-the-counter products, over-the-counter medications can interact with each other and can be used to support your health, but can also put your health at risk, and how to safely navigate those pitfalls. So, why are over-the-counter medications risky? They're not risk-free. Nothing you put into your body, including food, is. But they are deemed to be lower risk by Health Canada, and so they're available without prescription and without the intervention of a healthcare provider. That is the general reason why you can go in and buy these things off the shelf, is they're considered generally safe. But that word generally's got a lot of holes in it. When we look at over-the-counter medications, we can find things that have duplicate ingredients. We can find things that have similar mechanisms of action where they are working in the same way and not getting getting duplicates of them. That's not the same ingredient, but the same kind of ingredient. We can see interactions with prescription medications, as well as interactions between different over-the-counter products. Interactions with medical conditions. There are certain medical conditions where you shouldn't take certain over-the-counter products. We're looking at things that are unsuitable for use in certain patient populations. Patients with kidney issues, patients with liver issues, patients with diabetes or high blood pressure, children, patients who are pregnant, as well as there are certain products that present high risk for an unintentional overdose. And I know overdose nowadays is kind of a loaded term. Everyone thinks about illicit substances and opioids, but you can overdose on basically anything you put into your body, whether it's water, food, over-the-counter medications, or something you find on the street. And it's where we look at these over-the-counter medications, there are certain products that have higher risk for an unintentional overdose. So we're going to be covering some of those as well. First thing we want to look at is duplicate ingredients. And a lot of cough and cold, pain relief, allergy medications have similar ingredients in them. One of the most common is acetaminophen or Tylenol. If you look at most cough and cold products, including, and I'm sorry I forgot to bring this for our interactive portion, neocitrin, or similar products like it, everyone thinks that's just a tea, but it actually has Tylenol in it, and well as other medical ingredients. And taking something for pain, I've got a cold, I've got the body aches, I've got the chills, I'm going to take Tylenol for pain, and then I've got my Buckley's for my symptoms. Well, they both have Tylenol in them or acetaminophen in them, and that puts you at higher risk of accidentally taking too much Tylenol, which is one of those medications we'll cover later that has a higher risk of unintentional overdose, especially for that reason, and that it's in so many things we just don't really think about it. And if you're not reading the ingredients carefully, it's very easy to accidentally double up. The other thing is prescription items and over-the-counter items. There are a lot of duplicates over those. There's acetaminophen or Tylenol and quite a few prescription products that you can get that you wouldn't necessarily think have it in it. But there's also duplications in muscle relaxers that are available in prescription and over-the-counter. Some people will pick up a muscle relaxer and say, you know what, I've got this and I've got my stuff from my doctor, I'm going to take them both. And that can you can be taking the same ingredient at the same time, which can lead to not much more of an effect depending on the ingredient and a lot higher risk of side effects from it. When we look at pain relief is really the biggest one, but we also look at antacids and mineral supplements. Who can tell me what's in Tums? Calcium. What do we take a lot of, is especially For older adults, we recommend high-dose calcium supplementation, especially in women postmenopausally. And taking that and then taking the extra Tums, because you've got indigestion, popping a couple every meal, you can accidentally end up with a significant amount of calcium that you weren't intending or didn't realize you were getting. Same thing with Gaviscon. Anyone know what's in there? It's magnesium. And magnesium is, again, something we regularly recommend patients supplement, especially for bone health, but also for muscle cramps and difficulty sleeping and cardiovascular health. And so if you're taking a bunch of Gaviscon along with your magnesium, you may accidentally end up taking too much. And these are things that we don't really think about when we're taking over-the-counter medications and over-the-counter products, because we don't think about it. Why would we? That's what my job is to think about it for you. Then we're looking at medications and over-the-counter products that have similar actions. We're looking at, mostly in this case, anti-inflammatories, so Advil, ibuprofen, Motrin, Aleve, naproxen, aspirin. They all are anti-inflammatories, and individually, they're fine to take. But if you say, okay, well, you know what, I'm taking my Advil cold and sinus, and I've got a prescription for naproxen, or I'm just going to take some Aleve off the shelf. They're both anti-inflammatories, and taking them at the same time increases your risk of developing stomach ulcers and that sort of thing. So we want to, again, we're not just looking for the same ingredient, we want to be looking for things that do similar things. And that's a lot trickier to figure out, because you can't just look at the label and say, acetaminophen, acetaminophen. When you pick up the Advil, it says ibuprofen, and when you pick up the naproxen, it says naproxen, and they both say pain reliever on it. But they don't always say anti-inflammatory. And that's where consulting with a pharmacist, a physician, a nurse practitioner, when you're picking out these over-the-counter products, is important to help prevent duplication of therapy from your over-the-counter and your prescription products, or from multiple over-the-counter products. Allergy is another very common one where we will see some crossover, and sleep. Who can tell me what the difference between Benadryl and ZzzQuil is? Marketing. They're both the exact same chemical. They are both diphenhydramine. But you don't think that. You think, okay, I've got ZzzQuil for sleep, had an allergic reaction, let me take a couple of Benadryl. Or some people do still, even though it's not recommended, take Benadryl daily for seasonal allergies. Take ZzzQuil for sleep. Well, all of a sudden now you're getting too much of the medication just because you're not looking at the ingredients, you're not thinking about it. I mean, heck, before I became a pharmacist, I didn't think about it. But there's things like that where they're just different marketing. And you don't really realize that if you're not looking at the ingredients. I guess that's really the moral of today's presentation, is make sure you're checking your over-the-counter product ingredients. Then we have interactions with prescription medications. Taking anti-inflammatories and blood thinners regularly can increase your risk of bleeding, which we want your blood to be thin. That's why we have you on a blood thinner, but anti-inflammatories thin the blood as well. And if we're having you take it consistently, that increases your risk of developing a major bleeding event. Short-term use, unless you're really, really high risk, is usually fine for acute short-term conditions, but we want to really avoid that for long-term pain management in patients who are taking blood thinners. And now we're going to get into some of the vitamins and herbs as well. Vitamin K is available in multivitamins. It's available on its own. It's available in bone health vitamins that have calcium, vitamin K, zinc, vitamin D, all in it. But patients on certain blood thinners, vitamin K actually counteracts the blood thinner. We give it as a reverse. We give vitamin K as a reversal to the blood thinner. So if you're taking that when you're on warfarin or Coumadin, we can adjust for it if you're taking it regularly. But if you take it sporadically, we're not going to know that it's impacting the thinness of your blood, and we're going to see an increased risk for clotting. which is why it's important to always check not just medications, but vitamins, minerals, herbal supplements. And another great example of that is St. John's wort. Commonly used as an herbal supplement for depression, anxiety, mental health, interacts with basically every medication under the sun. I can think of maybe 2 medications it doesn't have some form of interaction with. And if we don't know you're on it, we can't adjust for it. There are certain medications you absolutely should not take it with. There are ones that we can adjust the dose for and look at maybe changing your prescription therapy if you want to stay on the St. John's wort, and you're finding that it's helping you. But if we don't know, we can't help. A lot of antibiotics, a lot of antifungals, a lot of antivirals, a lot of the things that we're going to be using for kind of high-risk conditions are significantly impacted by that. And if you don't, when you go in and they say, you go into the emergency room, okay, what medication are you on? And you only hand them a list that contains your prescriptions, you're doing yourself a disservice, because if they don't know what you're taking over the counter, what you're taking as an herbal supplement, what you're taking regularly as an herbal tea or tincture, makes it difficult, because they'll give you something and see massive amounts of side effects and not know why. Or the medication won't work as well and they won't know why. So making sure you're keeping a complete list of everything you take regularly is really important, because that will help you in the long run if something does happen. Antidepressants and anti-inflammatories. A lot of people don't know this, but a lot of antidepressants have a mild blood thinning effect. And if you're taking that regularly, along with regular high-dose anti-inflammatories like ibuprofen or naproxen, can increase your risk of bleeding. Can also increase your risk of heart conditions, because the anti-inflammatories and the antidepressants both have an effect on your blood pressure and how the heart pumps. Calcium. A lot of people, as we've said, are on calcium. That one. Still. Yeah, I'm not done on that slide yet. Sorry, Kim. Oh, okay, we can just leave it. That's all right. I got my notes here. Calcium is something, as we've said, a lot of people are on. A lot of people take. Did you know you need to space it away from certain medications? It binds to them, prevents them from working. A lot of antibiotics are like that, where if you're taking calcium with it, at the same time, you may as well not be taking it at all. It's not going to be doing you any good. There are ones that we can avoid, and if we temporarily need to hold your calcium or adjust the timing of when you take it, that's fine. But again, some people get a lot of bad reflux from some antibiotics, and they'll pop a couple of Tums. And what have we already said is in Tums? Calcium. And so that can inadvertently, if you're thinking, hey, I'm making sure I can take this so that it's not upsetting my stomach, I'm going to take a couple of Tums, and then you're not getting any benefit from the antibiotic.
How long after taking certain medications should you wait before you take calcium?
So that's a great...
Repeat the question.
Yeah. So the question was, how long do you take, should you wait after taking certain medications before you take calcium? It's a great question, because a lot of people have that question, and we look at that when we're going in and counseling you on your medication or your calcium supplements. We want you to avoid calcium 2 hours before or 4 hours after you take the medications that can be impacted by calcium. There are some that aren't, that are fine to take with it. But when we're looking at those ones that can be impacted with it, 2 hours before or 4 hours after you take the dose of calcium. And that's also because the reason it's so longer after is because calcium acts as a constipant. It constipates you and prevents it from moving through as quickly, and it's still in your system. Cough suppressants and antidepressants. Very commonly used together. I mean, most people nowadays are on some form of mental health medication. And sometimes they're not on it for mental health. We use those type of medications for pain relief. We use them for seizures. We use them for anxiety. We use them for a whole host of medical conditions. But taking cough suppressants with it actually increases your risk of what we call serotonin syndrome, which is where there's a lot of fancy chemical interactions that go behind the scenes, but basically it ends up with very rapid heart rate, very high blood pressure, and in some cases can be a medical emergency and can imitate the symptoms of a heart attack. So using caution when you're on antidepressants or medications for neuropathic type pain, and when you're picking out cough medicines is also important. That's just some of the major interactions with with other medications. There's also a lot of over-the-counter medications that interact with medical conditions. Decongestants, which are found in cough and cold products, nasal and sinus products, those can increase your risk of high blood pressure. And if you have high blood pressure that's uncontrolled by medication, you should really be limiting or avoiding use of them because they can increase your risk of worsening high blood pressure. Anti-inflammatories and patients with heart failure or even patients with high blood pressure can cause anti-inflammatories can cause worsening of those conditions in certain cases because they cause your body to keep salt and then you keep fluid, and that increases the blood pressure and puts extra work on the heart to try and move that around. So when you're looking at if you've got heart conditions, making sure that you're limiting your anti-inflammatories, and if you can, using an acetaminophen-based pain reliever rather than an anti-inflammatory is going to be more beneficial for you in terms of the other medical conditions. When we're looking at glaucoma, patients with glaucoma that's untreated and uncontrolled, we really want to avoid antihistamines and especially your diphenhydramine or Benadryl or Gravol. Because they cause drying and can increase the pressures in your eye, which worsens the glaucoma and can lead to longer-term vision issues. And then lastly, one that we don't really think about, men with prostate issues, BPH, just benign prostate swelling. Antihistamines and decongestants both can worsen that and make it more difficult for you to empty the bladder and swell the prostate a little bit more. So really looking at other options, maybe if you're dealing with allergies, instead of using an antihistamine, you use a nasal spray. If you're treating sinus congestion, using a sinus rinse rather than a decongestant may be a better option. And these are just kind of very basic overview level conditions that interact with certain over-the-counter medications. There are a lot more, and that's why it's important, even though over-the-counter medications are generally safe, especially in our senior population. If you have a lot of medical conditions or take a lot of other medications, checking with your pharmacist before you're picking something up off the shelf is always a good idea. When we're looking at products that are unsuitable for use in certain patients, baby aspirin, who shouldn't we give it to? Babies. Baby aspirin is been renamed low-dose aspirin, but it was called baby aspirin for so long that that's still what everyone calls it. And it's really, it should not be given to anyone under the age of 18 because it increases risk of hearing issues as well as tinnitus and Raynaud's syndrome. So aspirin, even though you'll see it in a chewable form, which we would think, hey, kids, we have all the kids' meds in chewable form. It's got to be fine for them. Is not. There are very certain limited situations that would be dealt with by a specialist physician where we would use it. So if your kid is prescribed it, go with that. Don't use the general rule. But again, that's why we're covering these general issues. Pepto-Bismol. A lot of people don't know that Pepto has an aspirin derivative in it. So it shouldn't be given to kids. But then we look on the shelf at your local pharmacy and we see Pepto-Bismol for kids. And that's why it's important to check ingredients. Because if you look, the Pepto-Bismol for kids is calcium. It's basically a calcium chew repackaged that Pepto-Bismol, or the manufacturer of Pepto-Bismol, has made and marketed. And that's why checking ingredients before we're giving things, before we're taking things is important. Because again, you may say, you know what, I just want the chewables. It's an adult, perfectly reasonable. I don't want to take the tons of the pink liquid. Not everyone likes the taste of it. You pick up the Pepto for kids because it's chewable, and you're taking that with your Tums and your calcium supplement, and all of a sudden, we've got a lot of calcium going into your system. Vitamin E. A lot of people tout it as a miracle cure for a lot of things. But vitamin E in patients with certain heart conditions and in excessive doses can cause heart issues. It can cause heart damage. And it's over the counter. It's safe. It's safe in limited quantities in certain patients. And that's where we really need to be looking at, especially if you have other medical conditions, checking. Vitamin C, and this is me personally, I can't have any vitamin C. I have to avoid citrus. I have to avoid vitamin C supplements. I can't even take multivitamins because I have excessive iron, and vitamin C increases the absorption of iron. Now, we can use that interaction to our benefit when you're getting an iron supplement because your iron is low. We'll say take it with vitamin C because then you're going to get more benefit from it. So not every drug interaction is necessarily a bad thing. Sometimes we'll use them. And then fish oil and vitamin K. Vitamin K, we already covered the issue with patients on blood thinners, but fish oil has the potential to thin blood, as does vitamin E, and the thinning portion of the fish oils is the vitamin E component of it. But if you're taking a lot, and I'm talking excessive amounts of fish oil, it can actually increase your risk of a bleed. So it's something to keep an eye on and keep in the back of your mind that sometimes things that are good for you aren't always good for you. And this goes for prescription medications, this goes for over-the-counter medications, this goes for walking down the street.
What's better to take, omega-369 or fish oil?
So what's better, the question was what's better to take, omega-369 or fish oil? For the most part, they're synonymous. Unless you're getting an actual, like a fish oil, like a cod liver oil or something like that, most fish oils are omega extracts, whether it's omega-3, 6, 7, 9. So again, that goes to looking at the ingredients. It says fish oil on it, but fish oil is not a protected term. So when you're looking at it, they can be using it as, okay, hey, you know, this is fish oil. It's a supplement that you would get from fish oil, and it's a synthetic omega-3, 6, 9 supplement, or one that's derived from plants. So looking at the ingredients is important. But as for which is better, there's not really significant data either way showing that one is better than the other. Certainly, we know that different omegas help with different conditions. But those can be derived from synthetic sources or from natural sources as a fish oil extract. So you're getting the same thing in terms of clinical effect as long as you're using a reputable supplier of either. And that, did I have a duplicate slide in here? I did. Yeah, I think I had a duplicate. I think I duplicated it on accident. High risk for unintentional overdoses. We've already talked about the acetaminophen-based products. Those ones are very, very high risk just because they're in so many things, both prescription and over-the-counter, and we don't really think about them. Iron supplements. Because iron is so, we'll call it finicky, a little bit goes a long way in some patients. Those are over-the-counter, but they are kept behind the pharmacy counter. They're required to have a pharmacist intervene in the sale of them. Because taking too much can cause iron overload, which, believe me, I'm speaking from personal experience, is not fun. And then you also look, most multivitamins have iron in it. A lot of other supplements for either bone growth or hair support or Cardiovascular health have small amounts of iron in them. So little bits along with your other supplement goes a long way and can add up quite quickly. There are 4 vitamins that are fat soluble, which means our body stores them. Vitamin A, D, E, and K. Vitamin D, most people in our part of the country are deficient in fact, most part of Canada, just because we deal with winter most of the year and we're not outside doing things. Those of you who are lucky enough to escape for 6 months to somewhere warmer during the winter, you aren't as deficient likely, but we're still deficient in that here. So a lot of people take a vitamin D supplement, or they'll take a couple of vitamin D supplements, and then they'll take a multivitamin, and then they'll take a calcium with vitamin D in it. And those all, again, add up very quickly. Antihistamines are another one. As I've already said, they are found not just in your traditional anti-allergy Benadryl, but they're also found in sleep aids. They're found in cough and cold products. They're found in decongestants and other products like that, where you're taking multiple things for multiple different reasons, but they all have similar or same ingredients in them that can lead to that unintentional overdose, that unintentional toxicity. So, what can you do? Check with your pharmacist before you purchase over-the-counter products, especially if you have a lot of medical conditions or are on a lot of medications. Make sure you're reading your ingredients carefully. Checking and looking and seeing, okay, is this just something else repackaged? Is this got the same thing I'm already taking in it? And then remember to keep in mind herbal teas, tinctures, products that you don't get from a pharmacy like you would get from, say, a nutritional store that's in powder form that you're mixing in with your drink. A lot of those have vitamins, minerals, omegas, vitamin A in them. And making sure you're letting us know or your healthcare providers know that you're on those things, because they're not a medication. You don't think about them. And oftentimes, especially in the hecticness of an ER, they don't think to ask about them, because they're dealing with the urgent issue right now. But those things you've been taking every day for years can impact treatment in the ER. So making sure that you're keeping a list, not just of your prescription medications, but of everything that you take regularly and everything that you even take occasionally, because those will have impacts for your health in the long term. And keeping that list is something really simple you can do to help support your own health. I think I just covered that one. So it's time for our interactive portion of the program. I've brought along all of those products that you found in those pictures at the beginning. And we have, we're going to have a little game if we want. Oh, yeah, that's a good idea. If you want the answers to these questions, or what the answers of what they all have in common is, come to our next presentation. We look forward to seeing you. If you have any questions, we will be addressing them as we go through the rest of the interactive portion of the evening. Pardon? Oh. Yes, we are located at Mainstreet Pharmacy and Wellness Center, right next to the old high school in Kingsville, and the new medical complex at 200 Main Street East.
Recently, my husband had a sit-down with the pharmacist, and they do, I'm sure you do it as well, if I want to advertise that, where you bring in all your list of everything, and they sit down and they go through everything with you and tell you what might be interacting with the others.
Yes.
Consultation.
Yes. A meds checker, med review. Yes, we do that as well. But these, I do have a separate presentation that I've done on the importance of a med review, where I cover a lot of different things separate from the over-the-counter risk topics. But I do these presentations, other than my branding and logo, I do these presentations for the community. I'm not here to advertise specifically for my business. I'm here to help educate the community and inform the Kingsville and wider community about things that are important to their health. So I do cover medication reviews in a different section, but I don't talk about them as what I do. I talk about them as the general importance. Next time we will be here, if you want to come to our next presentation, on the second Tuesday in April, which is April 10th, right here at Unico Hall at 6:30. And we will be covering bug bites and tick bite prevention, which as we go into the spring, as we go into the fall, and the summer, especially in this area where we've got some great wooded areas, Point Pelee. We've got a bunch of natural parks in the Windsor-Essex County area. It's an important topic to cover as we go into that time of year. So I look forward to seeing you all at our next presentation on April 10th. And
Excellent. Thank you so much, Aaron. And stick around. We'll have questions and demonstrations after, but we're just going to end the recording portion now. So officially, thank you so much.
thank you. Thanks for having us.